Hi, I'm Samuel Grimes.
Hi, I'm Dylan Vogt.
Nolan Bias.
This is our capstone pitch project for NSG 435. So to start off and tell you a little bit about why we chose to do this project, we work and have all done our role transitions in an ICU setting, and I personally work as an intern in a 45 bed medical surgical ICU. And I work directly under the charge nurse in a lot of my shifts. And what this entails is the MSICU charge nurse of the day is always one of the leaders of the critical care response team. So that means that whenever a code, a stroke, or a rapid happen in a hospital, which are high acuity events where if a patient doesn't receive immediate treatment, they could have a life altering or debilitating event occur. They could die. The charge nurse responds to all of these. So, by nature of working under them, I grab an iStat and a trauma bag and I go to all these events with them. And in participating in multiple of these events a day, over the course of about a year, you start to notice discrepancies that happen and things that are out of organization or discoordination that is consistent, problematic, and might be fixable with the right kind of tools. Um, so we kind of developed a system in our capstone project around helping mitigate those errors and that kind of discoordination that happens in those high acuity events. Um, as there can be lots of people in a room, lots of overcrowding, unclear roles, people having the same roles and not knowing something's done, people not knowing who to tell certain orders to, and people just having a lot of general confusion about what their role is in the specific situation. So one of the things that we noticed are med-surg patients, like they have a high potential to deteriorate quickly if there's not immediate life-saving treatment. When staff is called, there can be no leader, there's sometimes no leader identified. There isn't a clear coordination between who's going to be giving meds, who's going to start compressions, who's going to record the event, who's going to document what they did in the event after. And there's often conflicts that, delay the treatment that the people can get and a consistent amount of time that is lost in these high acuity events.
Good.
So, why does this matter? So, when the patient loses seconds, um, from the time that they like pass away, their organs are affected. Um, the delays worsen the outcome. There's an error and chaos, and the staff confidence drops, and it is really affects the staff and how they feel.
Next slide.
Yeah.
Okay, what is it there?
Okay, so what we're doing about the problem, what the kind of unmet need that we're solving is there is a lack of role clarity in these situations. There's no visible leadership, especially if the intensivist is busy and there's only a hospitalist available, because an intensivist can be busy at other codes, doing bedside surgeries and other things that would just take their time away from it. There's overlapping communication, people not knowing who to tell what they've done to, people not documenting things properly, and a consistent kind of gap in what people should be doing. So we're addressing that problem and how to fix it and how to kind of mitigate those errors from happening in real time.
Good. So, who does this affect? Uh, Obviously, the problem affects the entire care team, and you've got ICU and code teams that are involved with this sort of thing. So, it's really not a good situation to be in when it's kind of having a reverberating effect and spanning out and affecting everyone negatively. So, bedside nurses are often the first to respond in these types of situations. ICU teams are next. Patient care assistants sometimes with other tasks like compressions, equipment, maybe a blood sugar and whatnot. So then providers may step in to guide the treatment. And the main takeaway here is when there's disorganization, it impacts everyone negatively involved, and especially and ultimately the patient with those critical first few seconds and or minute when this sort of thing unfolds. So we want to make sure that we're on top of things.
So the problem scope. This is not just a floor to floor issue. This is a hospital wide issue, and this also happens on like medical surgical floors and different kinds of floors that aren't critical care. And when there's a there's a link between delays to decrease patient outcomes, and there are usually code inefficiencies. And when there's code inefficiency, it causes worse outcomes for the patients.
So in terms of current solutions, there personally where we all work and we have experience role transition at, there isn't really clear training for code situations. It's more of something that people are just expected to learn by the situation. But some of the current solutions include inconsistent modules, occasional mock code training, and on the spot role assignment. So there's no universal system that really helps people learn what to do.
Current gaps, the problem is that these solutions don't translate into real-time performance. Online training, we all know, lacks realism. Mock codes are kind of infrequent and inefficient. Most importantly, the roles are still being decided after the team arrives and even the action started. So that's where delays and confusion begin, along with hesitation and lots of lack of clarity and that sort of thing.
So our solution was to pre-assign roles before codes occur, and by doing that, we created color-coded badges, and that would allow each one of the nurses to know who is taking on what role during a code when it occurs.
So how it works, at the start of each shift, a nurse is going to have a Volt phone and they're going to be able to choose whether they're going to be in charge of airway, medication, compressing, recording, or a leader. Also, a respiratory therapist will be assigned to the general code situation. They'll have a matching color-coded corresponding badge, and when the code happens, it'll immediately tell you who's in charge of what, so you look at the phone and you know what's going to happen before you arrive.
So here's our prototype, and I'll move this over so we can see it better. You've got color-coded badges. Everybody gets a role, and that helps when dealing with a dire situation, and you can have more clarity when entering into a room who's doing what and why and how this is all going to unfold. So you have airway, compressor, et cetera, et cetera.
So some of the key points are for our project are that roles are determined before arrival, which allows for faster outcomes. The visual clarity is instant, so it allows for each nurse to know on the floor who's doing what, and faster coordination equals better patient outcomes.
This is an extremely low budget option. The badges will be cheap to make, and there's apps that are simple to kind of coordinate this with. It has a minimal technology update, so the phones that are already implemented would work well. Staff will have training sessions that they can help educate themselves from based off real life situations they've experienced.
So what we'd need to make the badges, we'd need to integrate them with the Volt phones, we'd need to adapt these and adopt these on units, and we need to train people on how it works.
So some of the benefits are it would reduce response time, it would reduce role confusion and chaos in the work environment. It would improve the coordination of all the staff, and it would help patient safety.
So some of the team strengths are the ICU and code experience. We have 10 plus staff interviews who all gave us unique input on how these codes affect in the real life and the workflow that actually happens. And this is a clinically relevant design with the badges that are clearly color coded that will help us choose what people do in the situation.
So in closing, we've got a patient scenario. We have a patient that's in crisis. We need to define the roles fast and clearly. We don't want delays in action, and we want better patient outcomes.
So here is our contact information, and if anybody has any questions for us, let us know.
Thanks, everybody. Thanks for
Thank
watching.
you.
Thank you guys.